So what you're watching here is a woman bringing her white friend to Nigeria for stroke healing. The man has stroke, partly paralyzed as you can see, and they went to this clinic, Ezekweche Clinic Center. It's in Onitsha. Let's watch. As you can see here, this is the healer here. This is a traditional healer, and he has started to give him some therapy. And as you can see, he's already stretching and winding his hand. So this is the clinic center, and but the thing is that, so you can search their name, right? If you want to connect with them. I'm a native doctor, a herbalist, and the way I treat stroke is different. So I'm going to try and explain my method, and I've healed so many people. Recent one was last week. Okay, of course, full total recovery is between you and your God, right? But what we do is significant recovery. Okay, recovery of mobility, recovery of speech significantly in 6 weeks. Okay, total healing might take much longer time. So I'm going to give you some tips. Remember, I'm not a medical doctor. Okay, always consult your medical doctor for medical treatment. First of all, physiotherapy is good for stroke patients, but it doesn't address the root cause. All right, 50% of strokes is caused by high blood pressure. So if you have high blood pressure now, try and heal yourself of it now. Don't let it graduate to stroke someday. Stroke is basically one of the arteries in your brain bursting. All right? There are many things that could cause it to burst, but one could be blood clot blocking the road. Artery in your brain is like a pipe. If it blocks, blood from your heart has no other place to go than to burst. And once it bursts, one side will go. If it happens on your left, your right side will paralyze. If it happens on your right, left side, and any other place, right? Some people have multiple strokes, they will not even know. There's one called ischemic stroke or ischemic stroke, where the artery is partially blocked. So the person just loses consciousness. They will just be like this, like zombie. You'll be touching them, no response. After a few minutes or a few seconds, they get themselves. So during this time, people start praying, thinking it's some demon possession, and after a few minutes, the person recovers themselves. They think that the prayer worked. No, the main stroke is still coming, because whatever blocked the artery is still there. Do you understand? Some people's artery has plaques. You know, like when you have a pipe and those particles are inside the pipe. So they reduce the width of the pipe. Okay, so water is now struggling to pass. So your heart has to work extra hard to pump blood through. And the thing is closing day by day with particles. You know, one day to close. That's when you hear burst, and that's another stroke. Many people that go to hospital to treat some of these strokes, they don't address the root cause. The root cause is that your arteries are clogged. As long as you didn't unclog it, it will still come. And second one is always more deadlier than the first one. So you have to start preventing it first. Okay? And before I go ahead, me personally, I believe that what causes this thing the most is the oil people use to cook in their kitchen. Because some of these people, they don't take alcohol, they don't smoke, you know, they don't eat ice cream and all these things. So where is the stroke coming from? You're only 70, you're already having stroke at 70. Meanwhile, our ancestors are clocking 120, 140 easy. You will see a 120-year-old woman, she can still walk, she can still talk, she can still remember everything that happened 200 years ago. So in your kitchen, if you're watching this now, go to your kitchen and throw away any oil that is not this. This is extra virgin olive oil. Extra virgin olive oil. Are you seeing it? It's not mixed with anything. Some of them, they'll write blended with. No blended with anything. This is extra 100% extra virgin olive oil. That's what you use in cooking to avoid arteries clogging up. If you can't afford it, this one I raised now in Nigeria now should be costing about 60K. Just this bottle now. I think this is 1 liter, 60,000. So, but if you can afford it, coconut oil. Coconut oil. If you pass this to highest, avocado oil. If you pass this to my hand, no demo. May you no go paralyzed one day. Many people, the oil they are using to cook in their kitchen is engine oil. Oil that they manufactured originally for engines. And they had excess of it. They now say, oh, what do we do with it? Okay, let's start selling it as cooking oil. And people are using it to cook. Your body and engine, Okay, so I've given you one tip. I can't say too many things because before TikTok will take down this video. In fact, if you're watching this video now, download it now, because you may come back and you will not see it again. They have suspended the video. And also, if you're watching this video, you need to do these 4 things now. Click this heart icon. All right. Drop a comment. Do you know any stroke patient? Drop a comment or tag somebody that knows. All right. You can send me a message. Click my name. Go to my profile. Click my name here, and follow me. You can send me a message. Okay. I will give you the traditional way we used to treat it. You will now discuss with your doctor whether you should do it or not. That's your own problem. I'll give you the traditional way, and I will give you recovery, significant recovery in 6 weeks, 3 to 6 weeks. Somebody even called me this morning, and that's why I even make this video, right? Somebody called me this morning and was saying that he can now move, right? And this is somebody, and this is just 3 weeks that his son did it. I don't know the man. It was his son that reached out to me. After doing what I told him to do in 3 weeks, the man can now stand up by himself, ease himself, go around. Somebody that was bedridden for months. Okay, so if you go to most of 50% of stroke is caused by high blood pressure, and high blood pressure is caused by many things, but primarily every time people have high blood pressure, you notice that either their kidney or their liver is not functioning perfectly well. So it's not filtering and cleaning the system well. That's first. And secondly, about 15 years before you get a stroke, you will start having weak erection if you're a man. Do you understand? Because the arteries down there will clog before the one up there. The one up here are higher. The one down there are bigger, right? The one down there are tinier. So if something is clogging your system, the tinier ones will close out first. So you notice that blood is struggling to get down to your gbola to rise. You will be in the mood, everything, your gbola will be dead because the blood is not able to pump through. That's your first sign that something is on the way in the future. So you should start treating it as soon as possible. And treating it is to find what is really the problem. Sometimes it may not even be related to high blood pressure or anything. But treating it is to find what is really the problem as soon as possible. That's when most people come. I just send them back to their doctor. Say, doctor, please check this, check this, check this. They just tell them that somebody said you should check this. And I can tell you 99% of the time, my suspicion is always right about what is the root cause of the problem. Unfortunately, I can't say too much here. Then if you can tackle it on time, you will never get to that stage where this stroke happens. If you have any elderly one at home now, you need to have, anybody above 30 should have a blood pressure machine at home. The way you have your wristwatch, your clothes, you should have a blood pressure machine. Every few days or a week, depending on how good your blood pressure is, you check your blood pressure. All right? 120, should be at 120, 80, you are good. 130 is okay, it's borderline, but once your blood pressure is going above 130, you have to do something to bring it down. Stay in the right range. Your body is your space suit. We're on a space mission. This Earth is chasing the sun, and there is moving around the solar system. We are space travelers. The Earth is our ship, and our body is our space suit. If your space suit gets damaged, you're dead. R.I.P. So just know that old age is different from sickness. Let me show you. You see, old age, this one is 105 years old, and she broke the 100-meter world record for old people. The other one is 90, and look at how he's moving his body flexibly. So if you are above 50 and you're having one sickness or the other, it's not old age. Even if you are 70, 80, it's not old age. 90 years, you are having knee pain, hand pain, it's not old age. You are sick, and you need to treat your sickness. You understand? There is a difference between being sick and being old. Old age is not sickness. You get, people don't die of old age. What they die of is organ failure. When the person is 140 years old, one of their organs may fail. That's the only time they go. You understand? Old age is just that you have stayed long on this earth, oxidative stress. It don't mean anything. It's just that your body is old. It can still function very well. So if you have somebody at home that has high blood pressure, you don't know how to treat it, reach out to me. I'll give you the traditional secret. I don't tell for free, or don't come to me looking for show free. Go to Freetown if you're looking for